I was struggling trying to speak, not sure if I'm having some kind of a stroke.
I say, you need to get dressed. We're going to St. Paul's to emergency. So that evening, his blood level, oxygen had dropped.
And this is a man who used to walk 11 kilometers a day on the seawall. He has no memory of the first 4 days in hospital. And it turned out that he had sepsis. And the cause of the sepsis was acute COVID pneumonia.
Dr. Russell would send a team out from the intensive care ward into the COVID ward. And because they were there, that kept me out of intensive care. And 9 days later, they sent me home.
When I left him at the hospital, I never thought that I would not see him for 9-10 days. Thanks to all the dedication and care from the health workers at St. Paul's, that he did come out.
And few people know that more people die of sepsis than die of heart attack. If you have 3 people with sepsis, one of those will be dead within a month, and 1 or 2 of the survivors will be left with disability.
And I'm thinking, wow, I really did dodge a bullet here, thanks to the people at St. Paul's. I have all the time in the world, thanks to St. Paul's and to Kathy.
And he's able to get home and live a happy life, walk on the seawall, and write a children's book with his grandson. And without the breakthroughs, they wouldn't have been able to do that. So it's pretty amazing, I think.
Thank you for saving our Papa.
I would also like to thank all the supporters of the St. Paul's Foundation. They help save lives. It's as simple as that.
To those of you who give to St. Paul's Foundation, I thank you.